Hello, everybody. Welcome back to the show. One guest I've been wanting to have on the show for quite some time is Greg Lucier. As many of you know, I started my career in spine. At the time, Greg was the CEO and chairman of the board over at Nuvasive, and he's gone on to a very interesting company called Corsa, which we'll get into. But more importantly, I'm excited to have you on the show, Greg. Thanks for joining us.
Omar, great to be here. Thank you for having me.
Absolutely. Before we get into your career in med device and everything that you've learned, I kind of want to learn a little bit about who's Greg? Where did you grow up? What was your childhood like, and how did you end up in this great industry of ours?
Yeah. I grew up in Norristown, Pennsylvania, which is a great place to be from and not necessarily return to. It's a blue-collar town just outside of Philadelphia, and grew up in a family of four. My dad was in industrial advertising for steel mills and foundries at the time, which were very prevalent in Pennsylvania. So came from a pretty modest background, went to Penn State for an engineering degree, and as they say, the rest is history after that.
Fantastic. Did you, foresee yourself getting into healthcare and medtech at the time, or what?
What a interesting twist of fate. I was actually in the locomotive business for General Electric, and I loved it. And I was leading a super cool joint venture with GE and Harris Corporation, the big defense contractor, to develop these very advanced software and electronic systems to run railroads around the world. I was doing very well, and literally one day out of the blue, Jack Welch called me and said, Greg, you need to move to the medical business because kind of what you're doing has a lot of applicability to the medical business. And so fly up to Milwaukee, meet the new leader there, a guy named Jeff Immeld, and if you guys hit it off, you should just move to the medical business. That is literally how I got into the medical business.
Yeah, I guess when you get a call from Jack Welch like that, you got to take it seriously. And Jeff Immeld is a pretty, storied name, just because if you look at the coaching tree, Kevin Mahoney from Boston Scientific was under him, Omar Ishrak of Medtronic. There's so many other names. What were the kind of things that you learned under Jeff Immeld?
Well, all those names were there all at the same time with me. It was a bit of a heyday era in the late 90s, early 2000s, as Jeff was doing a remarkable job building up that business from a couple billion to well over 10 billion in a pretty fast time frame. So you were in an exciting moment. You felt you were changing the world by building a pretty large medical enterprise. And Jeff, and I think this is why he ultimately got the top job at GE, was all about growth. And, growth is intoxicating. And that place had a really cool growth culture in the late 90s, early 2000s.
Especially GE Medical during that time. It must be pretty wild. I wonder, when you kind of look at your career, I think everybody has that one company that made them who they were or who they are. Would you say that GE kind of molded you for a lot of the trajectory you went on later on in your career?
Oh, for sure. All the practices that were so embedded in the culture by Jack at the time, you carried forward. They worked at the time because they were very innovative. Today, they're kind of commonplace, but then they were very avant-garde. And you felt you were kind of at the forefront of everything by sitting inside the General Electric company at that moment in time.
It was also, at least from how Jack Welch led, it was a pretty intense company with really high expectations. And I think when you look at some of the great companies in our industry, US Surgical being one, Ethicon in the early days, Intuitive, they had this sort of culture that was, some might say very cutthroat but intense. What were some of the lessons that you learned while there?
What I say to people about GE when it was the amazing GE, it was a very Darwinian culture. So survival of the fittest. Mm-hmm. And it also was a consequential leadership place where if you made decisions, you bore the consequences, good or bad. Mm-hmm. And it created utter clarity to execution. And that's why the company did so darn well in that period of time. And I think those are lessons that have to carry forth. And you look at all the great companies, they have that utter clarity of what they're trying to get done each and every day.
While you were there, what was, what was something that was probably the most painful thing that was ever told to you that changed you for the better?
Everybody, quick break, if you're a medtech CEO or a product leader, you're going to want to listen to this. And I want you to imagine you're about to have a product launch. You've poured your time, your budget, your reputation into a device you're about to launch. And after all of that effort, your FDA submission, boof, gets rejected because of cybersecurity. This sounds dramatic, but it's actually not. It happens all the time to medtech companies, especially recently with everything being digitized. This happens so often because medtech companies treat cybersecurity as a checkbox when it's now a non-negotiable design pillar. The FDA's 2023 guidance didn't suggest cybersecurity, it demanded it. So if you're not ready with threat modeling, penetration testing, SBOM management, incident response, and airtight documentation, you're not launching, period. And here's what most entrepreneurs don't realize. Scrambling to fix these issues last minute can cost over $250,000 and delay your launch by months, which imagine the investment of getting delayed, right? The more you spend time in review limbo with the FDA is lost revenue, lost market share, and lost investor confidence. And yet, so many founders and entrepreneurs I talk to, they still treat cybersecurity as a postscript instead of a strategic advantage. Now, I've held off bringing this to my audience as a topic until now because there just wasn't a medtech-focused cybersecurity firm that I trusted, and that changed when I found Blue Goat Cyber. They specialize exclusively in medtech cybersecurity. They've helped companies like bioMaru, Inogen, Natera, along with nimble startups to get to market faster with a 100% FDA success rate. I had the chance to meet the founder, Christian Espinosa, and his story really resonated with me. So after he sold his first cybersecurity company, Alpine Security, Christian actually faced a personal health crisis. He ended up in the hospital, and that moment made him realize how vital and vulnerable medical devices really are because a medical device saved his life. So he built Blue Goat to serve medtech CEOs and founders just like you. Whether you're pre-revenue or scaling fast, Blue Goat can offer fixed-free pricing, unlimited retests, and no surprises. This isn't bolt-on security. This is built in from day one. You wouldn't launch a device that hasn't been clinically validated, so why would you risk launching one that's vulnerable to attack? Blue Goat will secure your device, simplify your submission, accelerate your approval, and they'll do it in a way that fits your budget, your timeline, and your team. So here's what I want you to do next. Go to bluegoatcyber.com, schedule a discovery call. They do these amazing calls. They'll do an analysis with you, educate you more, because the cost of waiting could be everything that you've worked for. So that being said, go to bluegoatcyber.com and schedule that call now. Let's get back to the episode.
I
don't feel free not to hold back. We want all the details.
I was running this business, this electronics business, software business, and I then moved to the medical business. And my successor was appointed by the corporation, had come from the plastics industry, knew nothing about railroading, knew nothing about software or electronics, and the gentleman really struggled in that role because it was a very complex business. And about a year later, Jack hit me up and said, you did not leave everything perfect for that successor, and I blame you. And I said, well, Jack, I didn't choose that guy, and so I blame you. And, you never win that argument with a guy like Jack Welch. And I remember flying back to Milwaukee saying to Jeff Immelt at the time, do I got to go find a new job right now? And Jeff, to his credit, was a great mentor. And he said, you know what, Greg? You cannot ever walk out the back door of a company. And if you were to leave right now, you would be walking out the back door of a company. He said, trust me, Jack only cares about this issue because he cares about you and he wants to make you better. If he wasn't talking to you, then actually maybe you should think about something else. He said, but the fact is he's investing in the relationship by being pretty tough on you. And I was like, fair enough. And actually was a great lesson just about being able to take it, learn from it, and keep playing while you're a little bit injured, but play strong and a new day will come.
Early on in your career, I'm sure that you had a variety of, we can call them failures again, that helped you turn yourself into the kind of leader you are. And we'll get into some of the great successes that you had. What were some of your favorite failures?
I never worried too much about failure, just as a point. I'd say if I have a failure mode, I really do embrace risk, and sometimes maybe a little too much. And back in the day, earlier in my career, I bought a company when I was leading Invitrogen Life Technologies, and it was a early player in the CDMO space, contract developer and manufacturer in the biologic space. It was a good business, but there was a lot of presumptions predicated for its success, like that companies would keep outsourcing a certain type of activity to the company and the like. And lo and behold, when we got into it, the volume of the business just wasn't there. So literally after about 2 years, we were a publicly traded company. I had to sell that thing off for about a $500 million loss. And I got great advice at the time, which is, Greg, no one will care. They'll care that day. All an investor cares about is forward, not backward. So put it behind you and keep moving forward. And it was absolutely great advice.
Talking about risk, one of the big risks you took was, again, you're at not only GE, but GE Medical, which was on a rocket ship in the 90s, and you decided to leave. What kind of response did you get out of Jack Welch? I'm sure people told you you're crazy to leave GE at this time. Why did you do that?
Most certainly got that advice from Jeff and Jack at the time. But the piece of advice I always give to folks, Omar, is at some point in your life, you got to make a bet on yourself. And for me, that was that moment in time to take a role where I was chairman and CEO. I came in as a very large shareholder of Invitrogen, and I just decided I was going to make a bet on myself to see if I was any damn good. And by the way, I kind of knew that GE would not do awesomely over the next decade, just because of the law of large numbers. And so I felt like taking a new path was going to be a lot more lucrative and good fortune if we did it right.
What do you mean by the law of large numbers?
GE, when Jack stepped down and Jeff stepped in, was the most valuable company in the world. It had a sprawling set of enterprises in GE Capital and the industrial businesses, ranging from NBC to the medical business to still holding on to a lighting business from Thomas Edison 100 plus years ago. Just a big company that growing those earnings would be a difficult challenge.
Got it. Departing from GE, when you think about all the lessons you learned there, the successes and failures, what's the one that stands out the most?
First of all, I loved GE, and that was the toughest decision of my life ever to leave that place. And I, on the day, had to give my resignation. I almost was going to back out. I remember I was in Milwaukee, it was snowing, and I said to my wife, Marilena, I think I'm not going to do this. And she looked at me and said, no, you're definitely doing this. And I give her a lot of credit for pushing me to go do it. So anyway, I don't know if I answered your question, but I just remember that moment in my life.
But when you think about that day that you were leaving and when you took over at Invitrogen, what was the one big learning that you kind of kept in mind at GE? I'll give you an example is that I think you had mentioned in the past, one of the things you learned from Jack Welch was this idea of just harsh truth, face reality, no rose colored glasses, right? And obviously the other thing at GE that Jack Welch was known for is holding a really high standard, and that there are consequences to those kind of things.
Yeah.
Other than that, what stood out that kind of was a sort of a guiding North Star for you when you took over at Invitrogen? There had to have been something.
I'll tell you, I had two things that I really wanted to think about besides the two you mentioned. One, I knew nothing about molecular biology. I was an engineer. We were in the engineering business of medical devices and diagnostic imaging. And I had to learn DNA, RNA, protein pretty damn fast if I was going to be effective as a leader of that business. You have to know the substance of the business you're in. And we can come back to that point. So the first thing was how do I rapidly learn this business so I can make decisions effectively? Mm-hmm. So that was a whole learning process. The second, though, was the culture of science versus the culture of engineering is so different. There is a reason pharmaceutical companies are not Boston Scientific. And the people inside those science-based companies require an entirely different culture to succeed. So bringing my Darwinian thing from GE over to there, which, of course, that's the only thing I knew, I went with trepidation to make sure that I didn't damage that culture when I put it in place.
Interesting. When you went over to Invitrogen, at what point did you realize, oh, this sort of some of the cultural nuances I'm bringing from GE isn't going to work here? I need to change that.
Yeah. About 2-3 years in, I had taken a lot of that playbook of GE, put it there. It had worked pretty damn well, but not perfectly. And one of them was the consequence of that culture of removing the bottom 10% every year, which made perfect sense in GE. I did it at Invitrogen. But of course, the ripple effect, if you're taking out PhDs because they're not performing, whatever that might mean in that context, created enormous consequences through the organization that were not positive. Now, the one thing a great leader has, and there's like 4 things a great leader has, but the one of them they better have is the ability to adapt boldly. Now, everyone adapts, but can you adapt boldly? And the only way you can adapt boldly, in my humble view, is when you look in the mirror and you say, I'm the problem. And by the way, if you're the CEO, you are the problem, right? Everything emanates from you. And so I looked in the mirror. I got some advice that says, whatever playbook you just brought here, you better dial it back a little bit to make it work in this new environment. It was a hell of a learning for me that you can't always just keep taking a playbook and playing it forward. You have to be really malleable about pattern recognition, which can be a trap as well as it can also be a blessing. But in this case, it was a trap, and I had to change and get out of that trap and do something different for Invitrogen.
Now, you mentioned it was a science-based company. Can you tell us a little bit more about what exactly did Invitrogen do? What was the products and what was the market they sold into?
We were, as I always told folks at that time, we were in the business of science. And so our business was creating reagents and instruments ultimately to allow researchers to interrogate how life works. Stem cells, DNA sequencing, proteomics. We had the largest array of products in the world to allow a researcher to ask the fundamental question of I wonder how that works. And that was the business model. So the whole culture was centered on curiosity about what question was going to be asked next, and could we have a kit, a solution that would allow them to run an experiment to get an answer. It was a super cool culture.
Interesting. It's something that I appreciated. I remember when I first learned about you during my early years in my career, and we're talking almost 10 years ago now, that I remember looking up and I said, oh, wow, this guy actually understands the value of thought leadership and content before it was a thing. Because I think around 2009 and 2010, you also did some TED Med Talks.
I did.
So back then, the idea of CEO or founder-led branding and marketing wasn't a thing. It is now. Why did you decide to do those things back then?
At that moment, we were in this transition period of medicine. And we were in the game of DNA. We were in the game of DNA sequencing along with Illumina. And we all knew in that space that the world of treating oncology was going to radically change. You're going to have to read the genome. You're going to have to read the gene expression to really understand what the heck was going on with cancer. And it was crazy because we all knew that. We were running early activities with some leading researchers, but the med industry, the medical schools, up until actually very recently, had no program on genomics.
I can confirm that. I was in medical school around that time.
Yeah,
So yeah.
Were you learning genomics? Hell
Definitely
no.
not.
And so we had an obligation, and I give Jay Flatley a lot of credit too, to be out there in different venues to say, this is how cancer is going to be treated in the future, and we must get there faster. So it was all about influencing the medical community, primarily doctors. You got to start learning genomics because this is how you're going to have to treat cancer in the future.
So it's been almost 15 years since you gave that talk. One of the things you mentioned, which I thought was a really good analogy, is that we don't want genomics to become kind of like nuclear power, where nuclear power was safe and green and everything, but you don't see nuclear power plants all over the place because, I guess, of bad press, bad marketing. How do you feel about genomics today, sort of looking back in terms of what you said back then and how it is now? Do you feel like it's in a better state?
Yeah. I think we have absolutely prevailed in moving medicine to molecular medicine. Now, that said, I think the problem today in molecular medicine is it's too damn complex. I mean, you probably have friends, I know I have, that have battled cancer, and it's like, well, what test do I take next? What therapeutic do I need for this particular cancer I have? And it's too damn complex for the patient yet today. And the medical profession has to do a much better job of allowing a patient to navigate more successfully. That is a number one issue. Now, having said that, if you look in agriculture, we haven't done a winning job there. I mean, in Europe, you still can't do GMOs. And it's crazy. Like, the only way we're going to feed the world successfully is through GMOs. And to think that people still have perceptions that if you change the genome of a avocado, that somehow or another that's frankenfood is ridiculous. So we haven't won that one. And it's a shame because we are depriving a lot of protein and a lot of good food and nutrition to the world population.
Right. And I think we've seen, at least in ag tech, the impact of it, especially like in Africa, when you introduce, for example, I think in one region, they were able to introduce like a different kind of chicken that was able to just lay more eggs, you know? And so I think that's really important. I think that the only way you solve these problems is that you have to have genetically modified organisms.
100%.
You know?
Now, what's the silver lining to COVID, if there even is one? I mean, that's a whole nother topic. But the silver lining is actually like the vocabulary of the informed individual has changed. Like, they know what a reagent is now. They understand what a virus is. And honestly, before COVID, most people didn't even like, what is that? How does that work? Now you say spike protein, you're like, COVID. You know, I mean, they understand things now. And I think that can only help as the world gets ever more molecular, which, by the way, we're only on the very beginning of that journey.
I agree. Going back to Invitrogen, there was a period where you decided to transform it from Invitrogen to Life Technologies. Why did that happen? And you know, what was the value creation decision behind that?
Invitrogen was doing kits, so reagents, super successful, the biggest in the world. And we knew if we were going to ultimately fulfill our brand promise, we had to be in the instruments to run those kits. So qPCR machines, genetic sequencers, mass spec. We needed to play into those instrument categories. And the company that made the most sense to marry up with us was Applied Biosystems, the venerable old Applied Biosystems that honestly had given the power to Craig Venter and the NIH to decode the human genome. But they had fallen on tougher times. And I literally got a call out of the blue by Stephen Cohen, the owner of the Mets now and one of the largest activist investors at the time. And his office said, would you like to buy this company? And I was like, I'd love to buy this company. And they said, well, we're going to make it possible for you to do so. And they put a lot of pressure on Applied Biosystems. We came in with our package and we were able to buy the company and merge it to create a new company called Life Technologies.
Fantastic. So it's just essentially you expanded your product line and your value creation to the instrument side.
That's right.
And for some of the instruments that you mentioned, is that the same world that Illumina plays in?
Well, it's the Thermo Fisher company now, right? They have this broad array of instruments, but Illumina only plays in genetic sequencing, and they're the world leader in that particular category. We were the second player with about 30% market share, and Thermo Fisher still is today.
Got it. So when you merge these two companies, and then eventually Invitrogen became Life Technologies, correct?
When we merged with Applied Biosystems, we bought them. We changed the overall name of the company to Life Technologies.
You know, I think that's such a important thing that you guys did, and I'm going to comment on why, and I'm going to try not to piss people off, but I can't help myself.
Why not?
But some of the more bad and unfortunate mergers in our industry, when they happened, specifically a strategic who acquired a robotics company and tried to merge it with another one. The problem, I think, is that you realize that going back to culture and people is that everybody has a team that they're playing on there in a jersey. And the wrong thing to do, I think, and you have a lot more experience than me, and I'm wondering your opinion on this, is that you don't take a company and say, hey, we're going to burn down your stadium and jersey and everything. Now you guys are going to come play with us. The better thing is to say, hey, we're burning down both stadiums, both jerseys. We're making a new company, new jersey, new team who wants to play on the team. Was that part of the thinking about why we start a new company with a new name and everything instead of just saying, tuck it in?
1,000%.
Okay.
I mean, and more recently with Corsa Medical, we've bought a number of companies and we've asked everybody to move to a new name called Corsa. And we tell them, bring your values with you. We'll mold our combined values, and off we go in a new way, in a new form together. And to your analogy of the jersey, I think is dead on. Like, you got to take off the old jersey to go to a new place.
Got it. So when you merged the two companies and started life, what were some of the growing pains you guys went through the first few years?
Well, the first one was getting the deal done. It happened in 2008, and
Not a good year.
that was a tough
That's
year.
a
It's
tough
the
year.
only industrial deal done in the entire year. And
Wow.
I remember being in Switzerland. I was meeting with some financiers who were going to finance the merger or the acquisition. And I got news that one of our Japanese financiers might fall out. And I was like,
Oh,
wow. I mean, we're living in a very different moment. And so getting past that was a heck of an accomplishment. But then secondly, because it was in that financial crisis era, investors were very skeptical that the merger could work. And we signed up for $300 million of synergies, which is a heck of a lot of synergies. And we achieved them in a year earlier time frame. So getting that done, putting in all the disciplined operating mechanisms to take the costs out, get the revenues to grow was the number one objective we had for that 2-year period.
got it. You know, after you did the deal and had everything done, what was the big, I guess not incentive, but what was the main goal that you were trying to accomplish at the time before you ended up selling Life Technologies, but before the sale of it, what was some of the goals that you were trying to accomplish, and what were some of the headwinds that you guys faced
Yeah.
post 2008 crisis?
Well, the first was making sure we could deliver on that integration promise. I mean, when you run a Wall Street-based company, you better deliver on the financial commitments. Second, though, and we were a bit of a harbinger of the future, we wanted to create a closed environment where a instrument would have RFID on the reagents, require you to like fill with our official authorized reagents on the instrument, create a system that then could do remote diagnostics on the instrument. So we spent a lot of time and effort putting all of those capabilities in place very early on for the array of instruments we had inherited from Applied Biosystems. That was the main strategy we were after, was to drive consumption of those reagents and build out a Life Technologies lab. So we would go into laboratories and we'd say, look, we can equip this whole place for you, unlike any other company on the planet. And I will tell you, a lot of the pharmaceutical companies found that to be incredibly comforting versus then at the time, it was a potpourri of a lot of different companies' stuff.
Interesting. So
And by the way, that's how Thermo competes today, right? I mean, they try to equip an entire lab. They have the great service capabilities to do all of it. And it creates a bit of one-stop shop for a pharmaceutical company.
So this was unique back then, which is to say that like for most labs, they kind of put together piece by piece. You were coming in and saying, hey, we'll take care of all of it.
You
for
got
you.
it. We'll take
Which,
all,
by the
all
way,
the molecular stuff.
for the audience, especially the people who are like earlier on in their career, you would be shocked how much time and effort it takes just to set things up. Like I think for a lot of startup CEOs, they'll admit that like one of the more like pain in the ass things they got to go through is like setting up all the different things from the CRM to the quality system, et cetera. So this was new back then for the space. Where did you get this idea where you said, hey, let's just go and equip the lab from A to Z?
You know, I wish I could say it was some sort of stroke of brilliance, but it was literally looking at the footprint of all the things we did in a lab, all the reagent capabilities we had. And it was like, why are we selling these things one-off when we can start selling it as a complete solution into a laboratory? And particularly, if you remember at the time, once we got through the financial crisis, the biotech industry boomed. And so there was a building spree going on across the United States on new labs. All those labs had to be outfitted.
I see.
And so you could come into a new, fresh biotech that just raised $1 billion and say, listen, we got you covered on your labs. Come to us and we'll handle it one-stop shop.
And I guess the nice thing about that is your contract value is better. I'm sure for EBITDA, it did like wonders
Way
for
better.
it.
Yeah.
Interesting. So, good times never usually last. So like when this started happening, what kind of competition did you face in the market? Did other competitors start trying to replicate the same thing?
You know, the other company that was starting to rise at that time was certainly Thermo and then Danaher. And so those three entities were the big players. Now, remember, at that moment, Thermo had merged with Fisher, so they created the other player in the space. There was Life Technologies, and then Danaher was starting to piece together a lot of the things that you now see as what is Danaher.
Got it. Now, considering you had this great trajectory and growth, what exactly happened that made you say that the best value creation you can have is to sell Life?
Yeah.
How did that all come together, and why?
As you look backwards, you say to yourself, like, should I sold Life Technologies? And the old saying is, you make all your money selling too soon. So I never.
And you sold it to Thermo for $16 billion.
16
correct?
billion.
Yeah.
Yeah. I mean,
that's a pretty good. That's
not
a
bad.
pretty. That's a great exit.
Not bad. So I never look backwards, like, was that the right call or not? I'm just making a facetious joke just on the Life journey. In the proxy, the story was basically, I actually tried to take the company private. I wanted to own the company outright with a partner, and we got close. It was going to be a very big consortium of private equity firms at the time because it was so expensive, but we weren't able to ultimately be the prevailing bid, and so Thermo Fisher was the topper.
For the entrepreneurs and CEOs who are listening, when you enter those kind of negotiations, what's interesting, I think, about exits is that a lot of times you can create a lot of value within you can sometimes create more value within the few months or years of negotiation than you did the entire life of the company. What kind of things did you learn during those periods as a negotiation?
Well said on that point. And that's even more germane to private equity, where your financials are not in the public eye. They are more private in terms of what's actually going on. And so how you exit a company in private equity ownership is probably, besides buying it right, 40% of the value creation, doing that exit right. So I just want to amplify the point you made. Like, exiting properly is a real skill set. In our case, though, because it was a public company, because I had made a bid to buy the company, we were in play. And the way it works in public companies land is then the board has the Revlon rule, where they got to just take the highest offer. And at that time was Thermo Fisher's. So then you're just really negotiating some terms and conditions, but honestly, it's just literally show me the cash.
Got it. I think a lot of times people, they think of the movies when they think of negotiations that there's some tactic or something, but like there has to be some kind of interesting tactics or at least forms of leverage that
well, in our
that
case,
you deployed.
We brought in Roche at the time to be the stalking bid. When the private equity bid wasn't able to be the top one, then I brought in Roche to.
How did you bring in Roche? How did, like, when you say you brought in Roche, how does that happen?
I called Franz Humer and I said, you may want to think about this.
Interesting.
Yep.
Interesting. And what did he respond to, like, when you gave him that call?
They partnered up with Sigma Aldrich to put in a pretty good bid. So we were able to work the two together, and ultimately, as I said, Thermo Fisher was able to prevail.
Got it. And not to get too in the weeds, but again, this, I know my audience is going to be curious about this. Is it as simply as picking up the phone or sending an email saying, "Hey guys, Thermo Fisher, I just want to let you know that there's a competing bid now," or how does that go exactly?
Well,
At this level, like with public companies and everything.
yeah. The investment bankers are pros at that, obviously. But, my own feeling on how you negotiate is you never put in front of a bidder that they have competition. You make them feel that they have competition.
Interesting. How do you do that?
Well, Omar, it's a good price you have here, but I think we're going to have to do a little bit better now.
Got it.
Now, is it because I have another bid? Is it because I just want you to bid more? I'll let you figure the mystery out.
Interesting. I love that you pointed this out because I think one of the lost arts that people don't focus too much on is persuasion, and you're deploying this ability to essentially get somebody to use their imagination, because you can guess what might make them move, but it's much better to make them imagine and let them do all that work. It's kind of like a scary movie.
Yeah. I've got a very good friend. His name is Jeff Morad. He's vice chairman of the McLaren race team right now. He used to own the San Diego Padres. And his statement is, in negotiations, it's all about whose view of reality gets to prevail. Now think about that. That's exactly right.
Interesting. I love that. I love that. Now, upon the sale of life, this is a very interesting thing because, like, when we look at your career, GE years, this was kind of like laying the foundation. You're at a large established company and everything. Then you decide to sort of go out on your own and say, hey, does this foundation, these playbooks, these philosophies, will they work out in the wild when I'm on my own? You were able to successfully do that at Invitrogen / Life, right? Then you made like a really radical change, and maybe I guess this is the theme here for your career, which is like taking on risk, which is you went on to a medical device company called Nuvasive, right? So
Not willingly.
now, so okay, plot twist. Why were you not? Why did that happen?
When we sold Life Tech, I was in no rush to, take on another CEO role. But I was asked to join the board by Alex Lukianoff, the CEO and chairman at the time, and so I joined the board. That's how I got to Nuvasive. And, Nuvasive then encountered a challenge where Alex had to go, and the board said, well, Greg, you're not working right now. Why don't you just step in as chairman and CEO? And so that's how I ended up in that chair.
Question for you about being appointed to a board. Why do you think your approach to be on the board, specifically at Nuvasive, and then what do you think it takes for somebody to be essentially a good board member?
Well, the first one was that Nuvasive at the time was, call it $500-600 million bucks.
Mm-hmm.
When I took over Invitrogen, that's about the size it was, and we scaled to well over $4 billion. And I know Nuvasive had aspirations to grow and be very big, and so I was brought on the board for my experience of having scaled a company pretty fast from a small mid-size size to a fairly large size at the time. Now, what makes a good board member? I think there are 3 or 4 key principles. One, a great board member certainly knows the difference between being a board member and being management. There's a line that has to be demarcated, and you should not cross it. So you're not giving direction, you're giving reaction, and you're giving counsel. But in the end, it's the management that has to make these decisions. So that's point 1. 2, I think you have to be able to open up your network and allow the company to benefit from your ability to have the network effect of the company to meet people, see things, and understand their markets better. So, I always try to be about, hey, let me introduce you, Omar, to this person. They may give you some insights on this or that. So I think opening your network to the company is an important aspect as well. And then finally, get the fingernails dirty. Now, that may sound like it conflicts my first point. It doesn't actually, but let me give you an example. If you serve on a comp committee of a board, you're getting into how do I pay these executives properly? How do I incentivize them properly? You can just look at the reports that you may get from a compensation consultant, which you should, but you should also marry it up with all your accumulated experiences that you've learned along the way at your companies or other boards you're on, and bring that into a very substantive conversation that, again, is about reaction, it's about counsel, but it's also then about formulating ultimately the right work product and result that company can use to properly incentivize those people in my example. So, it's this ability to respect management, open your network, and yet still be working with them in a way that really adds a lot of value to them as effective leaders.
Up until this point, who on your various boards that you had in the past, what board member had an influence on you about this is what a good board member looks like?
Yeah.
All right, everyone, quick commercial break. If you're a Medtech CEO / founder, or maybe you're a sales or marketing leader at a startup or a scale up, you're going to want to listen to this. Are you struggling to get in front of your ideal audience, whether that's investors or perhaps clinicians who want to adopt your product? Maybe you're getting ghosted. You send emails and messages and nothing comes back, nothing happens, right? Or worse, nobody knows who you are, right?
In business, visibility is everything. And I always tell people, if you want to persuade before persuasion can happen, you have to learn how to get attention. So if your sales team is desperate for traction, clinicians don't know your name, investors have never heard of you, you're losing opportunities every day. And that needs to change now. Not tomorrow, not next week, now. That's where my company, Khatib & Co. comes in. We don't just do marketing, we do growth. We figure out how to engineer markets by creating magnetic messaging that makes you impossible to ignore. And we build high impact strategies, of course, using social media, but other channels such as email, text, and others to help turn content and messaging into commercial pipeline and it leads into closed deals. As an example, we worked with a surgical robotics company in raising a $31 million Series A, and then they needed help on their pre-market release. So we packed their CRM with 198 surgeon leads and nurtured them down that ended up becoming 4 closed hospitals. 4 hospitals closed and adopted this technology within a period of 6 months, and they got 2 great key opinion leaders in the process. So whether you're a startup founder wearing too many hats, or maybe you have a marketing team that just spread too thin and they don't have the expertise, my team and I plug in and partner up with your company and we amplify your reach. From crafting powerful sales scripts to optimizing your team's demo calls, creating content, having it go out on a consistent basis, we transform your outreach into a growth engine. So if you're ready to dominate your market, you're ready to become a no name and people to know of you and take your calls and take your meetings, I want you to act right now. Don't wait anymore because you've already wasted plenty of time. Go to growmymedtech.com. That's growmymedtech.com. And I want you to schedule a quick call. My team and I will give you a free analysis with 2 to 3 actionable ideas. There's no strings attached. And if we're a fit, great. We can get partnered up and we can help you go to the next level. And if not, look, the ideas are always free. So do not wait and don't waste any more time. Go to growmymedtech.com right now and let's make you the go-to name in your niche. Now, let's get back to the episode.
My shout out would be Ron Matsikaria, the chairman and CEO of St. Jude Medical, who was on my board from the very beginning till we sold. He was a mentor. He was a lead director. He ran the comp committee for a while. I mean, he just was such a stalwart, great board member that taught me a lot about being a CEO and taught me a lot about watching a board member be a great board member.
You know, without naming, I mean, feel free to name names, but like without naming any names, what are some examples of things that are not good board members, right? Or not good, or I guess not being a good board member. So you mentioned like getting too involved with management, right?
Yeah.
So what
well,
else?
we at LifeTech, we had shall remain nameless, a very prominent CEO of a Fortune 100 company join our board.
Mm-hmm.
And we asked that individual to join our board because we were moving ever more into very sophisticated marketing. And this company was really good at marketing, but on the consumer product side. So they knew nothing about biotech or science or the business model we were doing. And the individual was so profoundly confident that they never took the time to actually learn our business and be humble in the beginning. And they were immediately dispensing with advice. And I mean, it pissed off everybody. And we asked the guy to step down, actually, pretty soon in their tenure.
I think for, a lot of early stage founders and CEOs, this is sort of like the nightmare scenario, which is you see somebody who you want on your board, you get them on the board, and the moment they're in, you're like, oh my God, it was a terrible decision. How can you get better about vetting out board members and essentially avoiding that? Because asking a board member to step down, it's not just like a simple email, right? It's complicated. So how do you go about better vetting out board members?
It's the old Abraham Lincoln statement, don't ever talk about yourself because enough will be done behind your back. I mean, I think the only way you find out truly about that individual in the board context and situation is talking to people that are in the ecosystem and like, do you know that individual? How would you talk about them in a board meeting and getting the real world reference of like what's really about this person?
Got it. It sounds like a lot of it is sort of allowing your intuition or, to sort of guide you on it, right? In terms
Well,
of the
that's
values
for
of the
sure
person.
if I'm interviewing you, Omar, but I'm saying like I never rely only on that because my gut and my perception can be wrong. Certainly can be. But I know if I talk to 3 people that you didn't tell me to go talk to and they know you, I know I can connect the dots between my own opinion and those 3 people's that may all differ, but then I'll develop a holistic opinion of who is Omar.
Got it. So going back to Nuvasive, you unwillingly took over as CEO. Can you set the stage for us? Like, what year was this, and where was Nuvasive in terms of revenue, their place in the market, et cetera? What was going on?
Yeah. It's 2015 when that happened, and I stepped in onto the management. The company was encountering kind of transition in its growth cycle. It had been a super fast growing company, but now was starting to get into a period of time where the growth was slowing. They had really penetrated their flagship product called XLIF, which was a lateral surgery they invented. And further, they weren't making any money. So it was growth, no profit. And Wall Street was getting pretty frustrated. So it was into that setting in which I stepped. And so you had a company that had to go through some changes to something.
Got it. So essentially, just like leading up to where you were, top line revenue was growing, EBITDA and profit margins were not.
Correct.
Got it.
And the growth had been starting to slow because they had really penetrated the market and competitors were coming into that procedure as well.
Yeah, and I remember that year where, XLIF had like a solid 4 or 5 years of growth, and then other lateral competitors started to come out.
You got it.
Spine, it's, I've been in different parts of medtech. Spine is a very dirty, and when I say dirty, I mean it is extremely competitive and tough place. And so, what kind of things did you start to implement that allowed Nuvasive to sort of hit its growth trajectory? Because eventually, a few years later, it ended up having a sale to Globus. Now that together they have a $12 billion market cap, they're doing great.
Yeah.
But what things do you start to implement year 1, 2, and 3 as CEO of Nuvasive?
With the benefit of hindsight, you look at a company like Nuvasive at that time, and it was growth at any cost, and that's why they weren't making any money. And so just to kind of think about it in hindsight, what we did at the time was to say, look, we don't want to hurt the culture too much because it's kind of a fun, cheetah-oriented culture about
speed of innovation. I remember that. Yeah.
But we had to put in some process just so that we could have repeatability and hopefully get some profitability. If you go all the way now to Globus, Globus is such a well-run company. It's run as a PE firm. They are like pinching pennies. So that's like the complete opposite of where Nuvasive was at the moment in time I took over. Now, you can almost question, like, should you have just jumped to that? But I think the culture shock would have been way too much at that moment in time. So Nuvasive had to go through this period where you did more process, you did more budgeting. You did things that normal companies do that, candidly, Nuvasive wasn't really doing it at the time. So that's point one. The second, though, was recognizing as dirty as spine is, you're not going to change it, right? Mm-hmm. So we had to recognize that we were in a little bit of the sports agents business. These reps, you're not even sure who they work for. Do they work for you or do they really work for the doctor, right?
Right.
Okay, so if you use them as Hollywood stars and they would appreciate the compliment, you got to treat them in a way like a sports agent would, which is how do you incentivize them properly? How do you motivate them? How do you keep them on your side to the movie studio side versus being too self-oriented? It's a tricky game. And, I wish nothing but the best for Globus because it's a tough thing to balance out.
No, definitely so. And so, I want to go back. You were mentioning about some of the things that had to change. Again, this also sounds similar to what you had gone through at Invitrogen, but in a different way, where there was a culture that helped the company get to a certain point, and it needed to mature out of that culture, right? So changing culture is essentially changing behavior, which is really difficult to do. What kind of things did you start doing internally that allowed it to sort of lay the foundation for that?
Yeah. With LifeTech, we were able to make that culture change pretty straightforwardly. I had been the same leader the whole time. I recognized that I had to change, the culture had to change if we were going to continue to scale. So by having the continuity of leadership and the trust through the organization, you're able to bring people along with you. And moreover, my approach had always been to be very humble and self-aware. Like, look, I may be the problem myself as much as anything. And so here's how I'm going to change my practices, leading by the example. It's a tougher deal when you're an outsider coming in to a very proud culture like Nuvasive, and you're saying, hey, we got to put in process. And everyone's like, wow, does that sound like, going to the dentist?
Right.
And so you've got a different dynamic that you're dealing with in a situation like that. But, as long as you're not emphasizing too much the bureaucratic edge of process and people can understand it, you can make some decent progress.
Yeah. And, startups in general like to move fast, but, with Nuvasive, the tagline was speed of innovation, right? And so I think, I would imagine one of the problems that you faced against is that maybe not backlash, but pushback that some of the people would say, which is like, hey, this is not what made us successful. This goes against us. But was it essentially just putting in the right systems and processes and, more importantly, getting the organization to focus that allowed to unlock that value?
There was that for sure. There was a couple substantive things we had to do. One, we had to be our own manufacturer. We had been outsourcing all the manufacturing. We were getting to the scale where we had to start doing manufacturing. And so that required an entirely new set of capabilities that did not exist in the company.
Why did you have to start doing? Because most people would think that once you start getting to a certain scale, you have to outsource manufacturing. So why that?
If you're going to be about speed of innovation, then we were going to be about being a fast prototyper and ultimately be a high velocity manufacturer and pick up the margin accordingly. I've always believed in being self-manufactured because I actually understand manufacturing pretty well, and I think I can be a pretty good one if we can have the time to execute it properly. So that was maybe my own opinion, but it's one I've carried with me into Corsa as well, which is we're going to be world-class manufacturers. We made that decision. We also made the decision to become very global. The growth was happening way faster outside the United States than inside the United States. So we disproportionately invested more capital into external distribution centers, sales reps all around the world to grow ever faster. That was the second big decision. And then lastly was just tightening up the overall operating mechanics of the company. How you budget, how you allocate the capital for the highest returns, asking tough questions that honestly were never asked, and building a culture where you could have really direct-handed conversations so that you could get to the right answers.
What were some of those questions that never were asked?
Why are we spending 10% on R&D when everyone else is spending 4%? Wow, that's a tough conversation to have if you're having that big of an organization and you're not probably getting the return on that R&D investment anymore. Mm-hmm. Made a lot of sense when you're a small company at 100 million growing at 25%. When you're a $500 million company growing at 6%, the returns on that capital are going to have to be a lot better.
Yeah, and right? Nuvasive, for the audience, it was a publicly traded company when you had taken over.
Yeah.
By the time you had left, you helped it go from I think 500 million in revenue to quite a little bit over.
But I think we were about $1 billion too. We grew pretty fast.
You're right.
Yeah.
Right. And so, would you attribute that to essentially, if you had to look at the main levers you pulled? Maybe give 2 or 3 of them. What would they be? Of the things that you had kind of talked about.
The self-manufacture ultimately played out pretty well. The globalization certainly played out extremely well. And then we put in, I think, good processes that allowed the company to have repeatability of being more profitable.
Was the self-manufacturing kind of like an economies of scale approach?
100%.
Where it's like, okay, got it.
Yep.
Got it. Okay.
Once you're getting to that size of $1 billion, you can leverage a lot of scale.
Got it. That makes sense. And, so you were, around what year did you end up exiting and leaving Nuvasive?
So I stepped down as CEO about 2 years later, handed it off to a gentleman named Chris Berry in 2018. Mm-hmm. And then I stayed several more years till 2021 as chairman of the board.
Got it. Now, again, Nuvasive is now part of Globes and stuff. Looking back at its trajectory and history, Is there anything that you kind of wish would have been different, or either you have done different or the company would have done different? I wonder, like, when you kind of look back and analyze it, like objectively, what comes to mind, if anything?
We probably could have moved even faster on how Globus runs their business, which is they're just a lot more clear on getting return on their capital, a lot more clear. And they're not playing the game of the sales reps still like a lot of the companies do in the space. They're like, listen, Omar, we appreciate your work, but if this is not the right place for you, then have at it. Go work for Medtronic. They wouldn't get into that game too much of trying to hold on to people out in the field. And I think that saved them a lot of time and effort.
Got it. And I think this is what's unique about spine is that, and I love that analogy that the rep is kind of like this agent. At the same time, the surgeons, I don't know what they would be, but that's another area where like there's not a whole lot of loyalty. And I think especially when you get out of a capital equipment and you're in implants and everything, it's so easy that a surgeon might just say, I think I'm going to flip some of my business, right? And I imagine that at least, so in our industry, I think that a lot of the sales to a hospital health system have become more complex. It's not just, hey, I'm going to show up with my bag and sell and the doc's going to use my stuff, right? But I think that in the late 2000s, that was kind of the tail end of those years. And so as a result, that kind of behavior is still perpetuated. Physician-owned distributorships, reps, the physicians, especially with being able to prototype so fast, getting like unique things out of Nuvasive. So how did you manage that specifically on the surgeon side?
Yeah, well,
because that's tough because you can piss some people off and lose a lot of your business. And as a publicly traded company, it would immediately show. As a private company, maybe you can
it would
navigate
immediately show. So look, I'd say at that time we were still very much playing the game like it was 2018, which is try to hold on to the customer as much as you can, even though they had no loyalty. Make it personal with the surgeon. To me, having a relationship with the CEO. I just remember at the time I was traveling incessantly trying to, meet surgeons, make sure they were still comfortable with Nuvasive and holding on to those relationships. Look, just more, I think, prophetically, I think the whole spine industry has to get restructured, right?
Tell me more about that.
Well, yeah. Look, it's a broader conversation, but we should ask the question of why are spine surgeons not undergoing the same level of transforming to employees like knees and hips guys have. And they haven't. They're still big money makers. They're still kind of independent practitioners, mainly practicing on their own, but also obviously having surgical rights at hospitals. And the hospitals don't have a lot of influence on the spine surgeon to say, Omar, you need to use this company because this is the company we've done a larger deal with. That's certainly what you've seen in general orthopedics, where hospitals standardize hips and knees on one or two companies. Today, you could still go into a hospital and they'll probably have 5 or 6 different spine vendors. It's insane. And it just drives healthcare costs up.
And, kind of a good segue, I'm going to pull out my phone here. We have a great partner in LSI, which is the Life Science Intelligence company. And so I wanted to ask you this question. This is sort of the LSI market intel question. So LSI's helped a lot of people from startups to strategics and Ps by essentially providing them with trusted data and insights that they need to make smarter decisions. So according to LSI's market intelligence, there are about 2.4 million spinal procedures performed in 2024. Do you think, and especially I think post-COVID, the way the public has gotten more interested in healthcare, do you think that we're getting to a period where spine surgery is going to be phased out? And so the example that we have is that if you look at invasive open heart surgery, a lot of that lost favor to minimally invasive techniques in cardiology. So do you feel like a lot of those procedures are going to get replaced with, let's say, either minimally invasive or motion preserving alternatives?
100%. I actually think, though, that spine procedures don't go down. I think they do change, though, as you just described, to be way more minimally invasive and way more motion preservation with artificial discs and things of that nature. Spine surgery, though, we're still in the early innings of the 9-inning game, right? It's the most complex geometry in your body. It's not generally a two-dimensional joint like a knee. And so I think we still have a lot of innovation that can come about in spine. I think the bigger innovation, though, is to fix the business model ultimately, because it's just completely not efficient to the U.S. healthcare system.
Got it. And how do you think that's gonna like more likely happen? So I think like if you look at broader orthopedics, essentially a lot of hospitals ended up buying up practices, and you're able to change behavior that way. But with spine,
But they also made the docs who do hips and knees become employees, right? So 50%
Right.
of all orthopedists are employees now of a hospital.
which is wild to me because I
Crazy.
remember growing up as a kid, back in the early 2000s. I think when the AMA did a poll, I think like 30 or 40% of physicians were employed, and now it's like well over 60%.
Yeah. I mean, you go to some subspecialties, it could be up as high as 80%, right? But spine docs is still very low. And, I think until that changes, then the influence of hospitals to standardize like they've done in hips and knees will just still always be out there.
Got it. Before we kind of move on to your, where you're at now, when you look back at your time in Nuvasive, what were some of the big lessons that you learned there? And actually, along with that, I'm going to sneak in this question: what was your favorite failure at Nuvasive?
Probably taking the job to begin with. I mean, I learned a lot about the underbelly of business and healthcare in that space, and
More so than life.
oh God, life was just a breeze relative to that. I mean, it was a great industry. It was a great time. You weren't dealing with these conflict of interest issues like that go on in spine. And spine was a real lesson in business ethics, integrity, culture transformation that could be very difficult to drive. It really forged the metal, as they say.
Yeah, and I want to ask you about this, and he may not like it, but I'm gonna ask you. He's in the back listening, but one of your right hand man is Michael Farrington.
Yes.
So I met Michael while at Nuvasive. We were on a panel together, so he was VP of marketing, but he was the first person that I knew of that evolved into this sort of newer role of not just chief growth officer, but chief people officer, right? And he's you brought him along over to Corsa. So what's your thought on that kind of a role, and do you see that sort of as the future of our industry in terms of these roles where it's like a combo of marketing and it's not really HR, but essentially it's development of culture and people.
Yeah. First of all, Mike Farrington is a real talent. I know he's been on your show before. He
Crowd
has
favorite.
One of mine too, and his role with us is Chief Growth and Transformation Officer. So I think it embodies this mixture of initiatives to drive success in a company. In my particular case, as I've stepped in to be Chief Executive Officer of Corsa Medical here of late, he acts as an amplifier of my work, of my leadership. So it's really great that at his stage of his career, he has the energy and enthusiasm to drive the operating mechanisms to a level of detail that make them incredibly successful. When we have operating mechanisms and issues come about, we can collaborate on okay, this is how I see it. And then Mike can put in his ideas, and then he has the ability to go execute them with the team in a very successful way. So I think it's a great role. It's a great role, particularly here in this particular environment for Corsa Medical. But to your kind of foreshadowing question, it might also just be a really key role going forward for a lot of companies. I like it a lot.
Yeah, I agree. I think the more that I think about it, the most I know a lot of companies. I won't mention them. Maybe I will. I know a lot of companies with great products that just didn't make it because they didn't have the right people, didn't have good people. And I know a lot of companies where average good products, but they had phenomenal people and they became wildly successful. And I think this ability to not only attract but retain and unlock value within your people is difficult, like really, really difficult. Now, if we look at your career again, GE, Invitrogen / Life, Nuvasive, these are all large, like one mega large, and then other large publicly traded companies. why, and again, this is a theme with you about not, risk and something different. Why go from that to saying, hey, we're going to do PE backed company now, and we're going to buy some assets and put them all together? Why do that? Because essentially the way I see this is that you're doing this and you're going to be competing with the Medtronics and Ethicons and J&Js and Strykers of the world. So why do that?
Fair question. Wasn't quite ready to, hang up my cleats.
Mm-hmm.
Wanted to be much more of an owner and much more playing at risk. And so partnering with GTCR now to build Corsa Medical from nothing into well over $500 million in size now has been a fun journey. And I think it's premised on a couple things. One, we're in categories that the other big guys have somewhat not forgotten, but not properly invested in because it's not as interesting for them anymore. A suture. Now, sutures are actually a really tough business to compete in, logistically, manufacturing-wise. And, so for us, if we could surround our ability to do some things like they do, but put great service on it, great branding on it, we can compete very effectively. And we are. We grow at double digits. So I just wanted to do something that really put it on the line and see if you could be successful. And I think we're going to be remarkably successful with this one.
What is the Corsa Medical story? You mentioned GTCR. Tell us a little bit more about that. Like, how exactly you leave Nuvasive, you go on probably a few months sabbatical, and then you say, "This is what I'm going to do next." How did all this come together?
I've known GTCR for years. When I sold LifeTech,
and GTCR is a PE firm.
They're a big PE firm. Good people inside the firm. When I had left LifeTech, GTCR bought a business from Thermo because Thermo needed the money to finance their acquisition of LifeTech. I partnered with GTCR at the time, put money into that deal as well. A lot of my colleagues from Life went over to go run that company. It's called Cole Palmer, and it's turned out to be a remarkably successful investment for all of us. So I knew the GTCR principles. We had trust with each other. So when I left Nuvasive, Dean Mijas, who runs GTCR, said, well, why don't we partner and do something new and different? And the idea was, let's go search the world. Let's figure out things we could buy, roll up, combine into something meaningful. And that's exactly what we've done with Corsa Medical. We bought a business out of Takeda called Taco Seal, a product line. We bought a company called Surgical Specialties that was in the sutures business. We bought a company called Katina for several $100 million that was doing ophthalmology type instrumentation. And we put them all together now, and they're all centered on the same idea, which is remarkable service, trusted performance, and outstanding value. Now, on that last one of outstanding value, like my view of healthcare is it's ridiculous how expensive it is.
Yes.
It's ridiculous. And the day of reckoning is coming. So we're going to be that company that you buy stuff from because it's a great value. And I think the categories we can play in are far beyond our $500 million. So at some point, we're going to sell this company or recapitalize it with the next partner. Mm-hmm. I'm going to put even more money in, and I think we can create a multi-billion-dollar enterprise ultimately.
Let me ask you, because you mentioned about the day of reckoning for healthcare is coming. Again, not something that is probably why some of these companies don't want to come on the show. But when you look at, I won't mention them, but let's just say the large blue chip strategics in our industry, one of the things that I personally feel is that what I think stifles, I would say stifles some innovation, even business model innovation, is this concept of bundling into hospitals. And
it's anti-competitive. It's antitrust.
Why is this not regulated? What? Oh God, I said the word. I shouldn't have said it. No. I said the R word.
Oh, is that you're not allowed to say it on your show?
I shouldn't have said regulated. But why? Yeah, but why? That's the thing. Because for me, when I look at some of the best technologies, when they get acquired by these larger companies, the first thing that I know is like, you know what? They're going to take this piece of capital equipment, this technology and everything, and they're going to bundle it together. They're going to devalue it and just say, hey, we'll throw in this.
Yeah.
You know?
Look, I think you've raised, though, a larger public policy issue this country has. And I'll go on my high horse for a moment.
Please.
The problem in healthcare is the fact that we have a 19th century thing called a hospital. And the hospital has enormous power, lobbying power, employment power in a locality. And, we're not going to ultimately mess that up too much as a public policy, although our current president seems to be wanting to disrupt a lot of things. And because these entities have such importance in our society, they get a free pass to some extent on this very anti-competitive behavior called bundles. And so do then the big vendors that are with them. It's a travesty. It's a big tariff and tax on our society, and the day of reckoning is coming because we're running out of money on this one. So I don't know when, I don't know how, but I just know that can't continue to exist as is.
So with Corsa, how do you compete with that?
Well, you're already seeing the cracks in the armament, right? I mean, whether you go to a secondary hospital that's really struggling because population is shifting, or you get entrepreneurial-minded doctors that are moving their procedures to their own semi-owned ambulatory surgical center, they care about having a good value. And they're not going to sit and deal with that bundle stuff. So where we go is there with many of our product lines. It allows us to exhibit world-class service, and we grow really fast. Now, we're coming back in. We're already in the hospital. We're coming back in big, but that's the next phase of where we go.
I'm going to make a prediction about this because you just remind me of this. Someone did something similar to this half a century ago, something like around that time, and built one of the most valuable companies on planet Earth. So Sam Walton, the founder of Walmart, when he came out, was competing against Sears, Kmart, all these, and all of them were trying to compete in these heavily populated metropolitan areas, right? And maybe the analogy for you is hospitals. And so what Sam Walton decided was to say, I'm going to go and dominate the rural areas. And so very quickly, if you look at a map of Walmarts over the years, those rural areas, which were small, in some ended up engulfing those metropolitan areas. Is that kind of an approach that Corsa is looking at, which is like, hey, if we go out to these, let's say, outpatient facilities, ASCs, et cetera, we can provide better value, better service, better prices, et cetera, and then make our way into the larger hospitals? Is that the thought?
100%. I mean, think about the conflict that a J&J has in the suture business. Mm-hmm. They sit under a price umbrella with their bundle on sutures to hospitals. And then what are they supposed to do? Go out to the ASC and, but you get it for 30% less because the bundle doesn't exist there? I mean, they have a hell of a problem. And I'm glad they have that problem, quite frankly, right? But so that's the issue, for sure. We go where the bundle can exist. We play, we service, we earn our business. But in time, we get stronger and stronger, and we come back.
Got it. And do you think this happened mainly because, ASCs and outpatients only have become a thing, and, it's steadily been growing the last 10 and 15 years, that J&J's the J&J's and Medtronics of the world manufacture the business, say, hey, we're going to come up with the best value, best product offering to these large hospitals. These other markets are not big enough for us to care about. But now they're becoming big enough to care about.
Yes, and they're starting to pay attention to it more and more, but it's a very fragmented customer base. And the business is very small in terms of gaining a customer here and there versus going to an IDN, and it's a huge customer that can move the needle for one of those big companies. I mean, again, I can't figure out when it all devolves, but I do know how it did evolve, which is over the last 15 years, just look at it. Look at Becton Dickinson as the poster child. They bulked up. They built a big horizontal offering, and they were able to then to create a hell of a bundle into the hospital, say, buy our stuff. And if you buy all our stuff, we'll give you rebates. And so it created a little bit of a tough thing to penetrate. Now, the devolution is obviously this issue that these hospitals are not the most efficient place to do the work anymore. It's devolving outward. And that's where we are, and they're still stuck over there with these big set of horizontal offerings. Again, I don't know how it all plays out. I just know what I'm doing.
Got it. How did you, and again, from a private equity standpoint, how did you go about picking these different businesses to buy? So you said you have a suture business, you have an ophthalmology business. What other business lines does Corsa have?
Yeah, so we have 4 business lines. We have a hemostatic business, biosurgery to stop bleeding in the body and surgery. We have a wound closure, a suture business that very fast growing. We have a biotextiles business, which is a outgrowth of the suture business, where we do very sophisticated loops and attaching devices for big medical device manufacturers. And then we have the ophthalmology business, where we're a Nordstrom, if you will, of a bag of really important stuff they need to do cataract surgery, retinal surgery.
You know, oh,
Now,
those,
how do it all come together?
yeah, I was going to say, because
Hey,
of those, the ophthalmology kind of stands out the most.
It
Like,
does.
why?
And it may be sold separately at some point. We don't know. I mean, we're all entrepreneurial inside this company. But, you know, when you're doing private equity and you're rolling up these things, you have to be opportunistic. They come at you when they come at you, and you make a decision like, does this fit or not? And by the way, you know, the ophthalmology business fits as much as maybe it doesn't fit. And so good enough. And we're able to learn from it, get synergies from it that add to the other businesses we have.
And then in terms of the distribution on the sales channels, you know, it's traditional channel in terms of like you have like your own medical sales force.
We do.
Got it.
You know, we go direct, and then we also have partners like Medline that are super important to us that love our products, and they make them differentiated in what they're doing.
How do you balance out, you know, with private equity's thing is like more short term. How do we unlock as much value as possible and exit? How do you balance that out with sort of the longer vision that you have for Corsa?
Great question. And I get asked this question a lot by our employees of like, well, what's going to happen when we sell the company, right? Because there is a horizon to private equity ownership. In my case, you know, I'm super fascinated by what we're doing, what we've built. And I just say, look, don't frame it in terms of a sale, frame it in terms of a recapitalization, which is what it is. We will find another equity partner at the right time. GTCR has been terrific to partner with. But I think we've built something here that's very sustainable and very expandable. And I intend to stick with it. I think it's going to be pretty damn cool over the next 5-7 years.
I'm excited for it. I think it's really interesting. Are there any other companies that are similar to Corsa where there's this sort of blend of like med device companies with a PE-backed, you know,
interestingly
framework?
enough, there's not many.
Right, because
PE
Corsa
is
is the only
not-
one I know.
PE has not invested much in med devices. I love that we're kind of a unique asset out there. And there's lots of stuff that we can go buy that are part of bigger companies that they want to get rid of, and we can bring the love to them that we've been able to do with the things we bought.
Fantastic. Now, just kind of rounding things out, and again, I appreciate you coming on the show. You're definitely going to come back on. We have to have you and Scott back on at the same
Love
time.
to have
It'll be a lot
Scott.
of fun.
Yeah,
Scott's a fan favorite. He's actually, we haven't done his annual episode yet, so maybe we should do it all together.
go.
Before we do that, we're going to take sort of like a pivot here. We talked earlier before we jumped on the interview about tariffs. So a lot of interesting things going on in the country now. What's your take on tariffs in terms of how it will affect our industry?
Let me level set everybody first. We have binding agreements with Canada and Mexico under originally NAFTA, then USMTA, that Trump renegotiated. These are binding country-to-country contracts that business people invested behind billions of dollars to create factories in North America. And people have to remember why we did this. During Bill Clinton's presidency, he wanted to achieve several things, but one of them was certainly creating the ability of Mexico to move up in its standard of living, be more equitable to the United States and Canada, and create stability on the North American continent, point one. Point two was to create an alternative to, as you said earlier, the rise of Asia, where manufacturing was heading to. And by leveraging the resource rich of Canada to the people rich of Mexico, you could create a formidable marketplace that benefited Americans. There were a lot of good reasons to do the NAFTA agreements. So companies have invested billions. Tijuana is one of the largest medical device manufacturing centers in the world now. San Diego benefits where we're sitting because we have all the innovation and the smart engineers. It's an incredibly balanced ecosystem on both sides of the border. Now, overnight, you inject a 25% tariff, which will make those Mexican or Canadian products uncompetitive. Or worse, what are we going to do? We got to pass that on to the consumer because we can't bear it. And so not only is it in violation of the principles of why we did this thing to begin with, which were smart and still are smart today, but we're also radically increasing the inflation into our country. So whatever you may hear by Trump saying, look, we're going to raise money for America, you're not going to raise money for America. You're going to actually create a tax on Americans, and it's going to lead to inflation here, and it's going to lead to a recession in Mexico and Canada, and we're not going to like how this spirals into something next. It's a terrible public policy.
Do you think that...
Have I been forceful enough?
No, that's fine. No, do you think that it's a potential negotiation tactic to kind of shake the box and see what comes out?
Let us hope that is exactly what it is. Time will tell in 14 days.
Got it. Yeah, now that we're talking politics, and again, like I chose the best for last, so like, and we're limited on time, but overall, like, what do you hope to see like here in our country in the next 4 years? For me, I'll go first. I mean, my biggest thing is that there's a lot of changes happening. I think what's the best thing about being an American and America is that we don't hold on to tradition. And so if something's not working, we're willing to torch it, right? And I'm hoping to see things change, and I'm hoping that we usher in sort of a golden age of America. That's my hope. Well, what about you?
I'm agreeing with you. Look, I love the fact that we're moving back to the melting pot, that we're all Americans, no matter where we came from. We melt into becoming the character of this country, which is all about the pioneering spirit. I love that. And I don't care about the color of your skin, your gender, or anything. We care about your commitment to the place and how good you are, and we're a meritocracy. That's point one. Point two, I really hope we get our fiscal house in order. And I'm terrified we won't, because if we don't, we're going to be in a very high interest rate environment, and that will destroy business confidence, let alone investment. So I'm hopeful that we get that right. And then lastly, I'm just super excited about some of the new industries, new capabilities coming online with artificial intelligence and the like. We don't even know yet how disruptive that's going to be, but I think it's going to be quite profound to everything you and I do every day.
100%. I think David Sachs, who's heading up, I forgot the department name, but essentially the team that's heading up all the AI initiatives, really excited about that. It's including laying down more laws and not regulations, but more transparency for the crypto industry as well.
Yeah.
So I think a lot of that's going to be really interesting, because I think, again, I'm biased, but America needs to be sort of the center of the world when it comes to a lot of these emerging technologies. The last point, since the new administration has taken over, I've noticed, at least post JPM, that there's been more M&A activity in our industry. Hopefully the IPO market will be better. Are you confident about that this year, or what's your take?
I'm confident. No, I'm hopeful.
Hopeful.
But I think we have to make sure that we're not driving change so fast that we create chaos, that people can't invest into the future, which is what you need if you're going to do an M&A. So that's the worry you have, but I'm hopeful.
Got it. As we kind of round things out, we got a few minutes left. So fortunately, we get to the fun part, which sometimes we don't get to, which is the rapid fire. So I'm going to ask you some rapid fire questions. Right. You can take as long as you want or answer them as quickly as you want.
All right.
Okay, rapid fire question number one. What's a book that you feel that you recommend or gift most often to people?
Read the trilogy on Theodore Roosevelt by Edmund Morris. It's fantastic about one of the unique characters of American history at 3 phases of his life. You will not regret the book, this set of books.
Got it. When you're not working, within Corsa and your company, what do you like to do for fun?
I'm a skier in the winter. I'm a motorcycler year round, and in the summer, I love a game of golf.
Got it. What's something that's interesting about you that somebody may not find on your LinkedIn page, your Instagram if you have one? What's something that not a lot of people know about you?
I hit a guardrail with my face. That's why I have a scar here, and I survived. How's that?
How did that happen?
I hit it with a sled, believe it or not.
Oh man.
Yeah,
Okay.
we're going a little too fast. It was a little bit of a dare. So
Got it.
anyway,
Got it. Are there any quotes that sort of always stick to your mind, whether it's something maybe your mother or father told you, or
the problem with communication is the presumption that it took place. It's a great reminder that while you may think you have communicated, you've only communicated if the other person really absorbed it. So, make sure you didn't just presume communication.
do you feel like that's sort of influenced you and in your various roles, especially when it comes to like managing culture and changing people?
I try to be very intentional anymore. Now I'm older, but I mean, like last decade or so, I've tried to be very intentional about how I communicate. I want to be very clear, penetrating where I can, so that the communication between us is understood.
Got it. Okay. Last few. This used to be my COVID question, but like we're post-COVID. But I think one thing that happened as a result of COVID is that we all got used to this dopamine hit of Amazon boxes arriving at our door.
Still have it.
I know, seriously,
Yeah.
it's bad. Like I had to watch myself because I'll be like walking and be like, oh, I should get that. I'm like, wait, do I really need that? But in the last like year or two, is there been an Amazon purchase you've made that's like really cool? Something under $100?
Bone broth.
Oh, I love bone broth. Tell me
Let's
what's bone
go.
broth. Yeah.
I
You're
am
you're
like
a
the
bone broth guy?
emissary of bone broth. I tell everybody, like, what's the one thing? Bone broth in the morning. Do it.
What
Dr. Kellyanne.
Dr. Kelly.
Have you had that?
No, is that the bone broth
Yes.
brand?
That's the brand. It's awesome.
Fantastic.
Because bone broth, as you know, can not taste too bad. This tastes really good. And it has a lot of protein in it.
Fantastic. So you do that in the morning and you fast, or?
I do. That's what I do in the morning.
Ah, fantastic.
Yeah.
I love that. I love bone broth. So
Yeah.
okay, so
That's why your skin
Kellyanne.
looks so good.
That's right. It's glowing. It's
Right.
glowing. All right. Last question for you, and
All
we'll
right.
wrap up. Again, I really appreciate having you on the show because there's a lot of great figures and leaders in our industry that thousands of people want to hear from, and you're one of those people. And I appreciate you coming on and being very open about your story and everything. But I want to give you an opportunity to speak directly to our audience, especially young founders and entrepreneurs who are listening and really absorbing everything you're saying. If there is a billboard that they're going to see every single day as they go into work, and perhaps that same billboard is a phone notification, what do you put on that and why?
You just got fired. What did your successor do? And I think a great leader, entrepreneur should be having that billboard in their brain every single day. Hold themselves accountable to the unknown and make sure they're not completely blind to it.
Fantastic. Greg, thank you so much for coming on the show. I want to remind our audience, be sure to give Greg a follow on LinkedIn. And Corsa Medical's website is?
Corsa.com.
Corsa.com. Easy enough. I want to thank you all for listening. Be sure to like and subscribe. If you know of an investor, an entrepreneur, or somebody in the medtech industry who would like this episode, please forward it on to them. And as always, we're the #1 show for a reason. Give us a like, subscribe, and give us 5 stars. And for now, we'll see you next time.